Anybody that is not a candidate for injection is not a candidate for this because we're injecting. But pregnancy and breastfeeding, no, we don't work on those clients. History of allergic reaction, PLLA, PDO, PCL. Now we know there's none to PDO. That's not really a concern, but PLLA there could be. And PCL could be because they're a different material. I have heard of some with PLLA material, not really with PCL. Don't use on near implants. Big deal, okay? Depending on where you are, you might not know they have an implant. They can have cheek implants, they can have chin, they can have usually breast augmentation, we know, but or butt implant BBLs. You don't want to do that. If you puncture that implant, you're done. They're going to the emergency room and you just paid for them to get redone. So no implants. Of course, no open sores or infections. We don't want to spread infection. If they have cystic acne, we don't want to put threads under active cystic acne. It can spread the infection. If it's healed and it's scarring, we're fine, but we don't want to work on active. If you have anticoagulants such as Coumadin or heparin, again, we talked about that yesterday, depending on what the person's health concern is. If they're on one of the prescription blood thinners and it just makes their blood normal, then the doctor could sign off and say, or if you're the acting on that, you may deem it's okay to work on that person. But in a med spa, and you're an RN and you don't have a doctor on site and you may not know this person's history well, I wouldn't do it because you don't know what's going to happen. If you stick them, they might bleed like a murder victim. Err on the side of caution. Predisposition for keloid. If the keloid, we don't work on them because we're sticking them, they can keloid. If they have a history of anaphylactic shock from it being allergic, we all know that one person that's allergic to everything, even the air. Don't work on them. It's not worth it. I'm not going to work on somebody that I know is so sensitive to any kind of reaction. If you choose to, that is your decision. But if I know that they are that client, I'm not going to take them on. Hepatitis B, C, and of course, AIDS. Anybody that has a serious illness, unless you're the acting doctor on that case, you don't want to fool with it. Most of this is anti-aging, and we want to err on the side of caution. That's why I said, but I have the acting do it because it is bloodborne pathogen, but it also, most of them are on immune suppressants of some sort, and they won't heal well. If you are a physician and you know this person's history, if you're managing their case, you may deem that it's okay to work on it. It would help that client. Sculpture is another thing they do on those patients too. But again, that's one of the things that you would want to do as the acting physician or with the acting physician signing off on it. You definitely want to be very particular about your bloodborne pathogen protocol. Any type of chronic disease now, diabetes, I work on people, almost everybody's got a little bit of it these days, as long as they have their A1C in check, it's fine. If they ain't got an A1C over 10, they got bigger problems than getting their face fixed. They need to get their A1C checked before you start working on this. They're not going to heal properly. Tuberculosis, of course, we're not going to work on those either. Severe allergies, we just talked about that. Blunt force trauma. Now, I'm working on people who have blunt force trauma because they usually have asymmetrical problems, and I can go in and help them with that. But you need to know what happened and where the scar tissue is, because going through scar tissue is like going through concrete. If you're not experienced with working on that kind of tissue, hit resistance and you're going to be afraid to do what needs to be done to get through it. That is an advanced technique after you've been doing threads for a length of time, long time. Or an advanced injector and injecting for years, and this is just another injection material. You need to know what you're doing with that. Of course, we don't work on drug variety. This Never a good thing. If I know they're a spot hopper, I won't take them on. Managing expectations and working on our client sets us up for the best clients. If you work on somebody who is a spot hopper and they have body issues, you're not going to be able to fix them and you don't know what somebody else did. So I strongly advise in your consultation that you get personal with new clients. Most of you are working on people you already know. But if you're starting to bring somebody in, like I won't take on anybody. If somebody reaches out from Instagram and wants a procedure, no, I won't see. You have to be referred by my plastic for me to see. Because my reputation is everything. I'm a trainer. I can't have some crazy person bashing me on the internet. So I'm very selective about patient selection. Oncology patients, if you are going through cancer and radiation, you can't do this. Your body can't repair itself. But when you're done with it, you can do a lot to help that person. So when they're done healing and through all the chemo and they're on their body is healing itself, they're back to fairly normal, you can work on that. Anything that is an inherited blood disorder, hemophilia is the most common. You don't want to work on them because they're not going to clot. They're not going to heal. And if they're sick, if you've got the flu, COVID, whatever, don't work on them because you don't want what they got. And number two, they're sick. The body can only heal one thing at a time, which is another reason I limit, like I'll do maybe the face one time, the neck, the next. Body, if it has one thing to concentrate on healing, it's going to do a better job. So some of this is just common. So lasers and Kybellas, lasers should always be done first. We do our laser treatments. Why do we do lasers first? Yes, because lasers dissolve. Heat dissolves stress. So if we want to get rid of our fluids, you can laser, but we don't want to get rid of them. We want to keep them there. So we do all our laser first, tighten all the slack we can with that, and then go in with our threads after the fact and really contour it, lift it up, and get a fabulous result. This says Kybella 3 to 4 weeks prior to the procedure, but depending on how much fat you've got to dissolve, that may not be done dissolving and the healing may not be done with Kybella. So go by that protocol, and when that protocol is finished, then you come in and do your threads. Neurotoxins, we definitely want to do that 2 to 3 weeks ahead of time. Why? We don't want to use blood thinners, and aspirin and vitamin E are blood thinners. Also, visual blood thinner. Also, palmetto. Some of the is a blood thinner. Certain things, natural supplements, blood thinners. I did a couple of years ago. I was training a doctor down in Wilmington. We'd worked all day and she wanted me to do a forehead lift on fur before I left. So we'd work on people all day and I go and I stick that vector with that 18-gauge needle to open up for her. She bled like a murder victim. Blood is rolling everywhere. And I'm like, what in the hell have you taken? And she said, but no, you took something. After talking and bouncing around for me, she said, well, I took palmetto for, workout supplement. I said, that's a blood thinner. They give that to prostate cancer patients to clear the prostate out. I was like, are you kidding me? It just becomes so commonplace. The reason we don't do that is because it's a mess and they're unreasonable. If you run into that situation, you're usually going to have to finish the job. It's on them because they didn't tell you. You're going to tell them you're probably going to bruise. If they want you to continue, you're probably going to bruise. You're probably going to be a little more sore. But most of them are like, I don't care. Go ahead. We're there now. Let's go. That's why we don't want to do anything that thins the blood because it's just not good. Yeah. Yesterday, you heard me say, and I was saying that. Nurses, we drink wine and coffee, and that's all we drink. We're lucky we get a drink of water. Dehydration is a problem. alcohol is a problem. One of my very best friends was a model. We did a lower facelift on her with threads, and then I laid the smooth over the top of it all around the oral collagen and made her jawline so beautiful and made a nice, she had her cheekbones again. It was beautiful. Now, we were in a training. She was one of her models, so I've done tons of work on her. She leaves and goes, she comes out to drink. She leaves and goes to another girlfriend of mine's house who's having a get together that night. She says, I only drank 2 White Claws. She had a bruise worse than Stephanie's and this big right here. I know you drank one too. It's like, no, I didn't. And that was after the procedure. We know not to do it for. But see, afterwards that night, we had went through there with all those cannulas and sutures. There's going to be little tiny capillaries that we have nicked and went by that have just a teeny little hole. The minute that blood gets thinned by alcohol, it's going to ooze out of that little place where normally it wouldn't have been big enough for it to cause a bruise. So don't drink the night of, and just for safety sake, don't drink the next day. For that 3-day window, if you don't want bruising, go ahead. But if you don't want to bruise, abstain. Laser, you need to wait till the threads have dissolved before you do the laser because the laser is going to dissolve the threads. Most of our threads are going to be dissolved in 6 months because we're using PDO. But if you've done PCL on that person, those threads can be in there 2 years. They're going to dissolve those threads and waste all their money. So that's one of the things. When you start being big into this and you find something that doesn't last the way it should, these are the kind of questions that you need to revisit to see if maybe they had a procedure when they shouldn't have had. So they don't always tell you because clients can be non-compliant, but